So this second panel is focused on a slightly different angle. This is our opportunity to explore some of the issues that were alluded to in the last panel, which is some of the risks and the consequences and the sort of downside of the evidence-based movement. I don't know if Akiva's still in the room, but there he is. When he mentioned, he started off by talking about evidence and we have to use evidence. And I hope this doesn't become a conversation that's anti-evidence. We all need to focus on the need to accumulate evidence and build a record of effectiveness and make choices about policies and programs based upon some information beyond our own impulses and biases and marketing pitches. The question is, how do we do that? And I think the first panel effectively raised some issues that clarify how difficult it is, that tension between going with good ideas and pursuing models that make sense to people versus adapting practices that have already been proven to be effective. One thing that's been irritating me recently are all the people that write about evidence-based practice who cite this number constantly. The number slightly varies, but I've seen a lot of publications. Only 5% of youth in the justice system are served by programs that are evidence-based, as if that's some kind of condemnation of the justice system, that only 5% of youth are served by those programs. And my argument would be, well, how many people should be served by those programs? Because what everyone thinks of as evidence-based programs all come from a very similar frame and a very similar approach. And are you really suggesting that saying that number sort of implicitly suggests that 100% of youth should be served by those programs? And I don't think that's a justice system we want. But how do we negotiate the proper balance? Should we always have a third of programs that are innovative and promising and in development, a third of programs that are rock solid, and a third of programs that are sort of on the chopping block because there's enough evidence to suggest they may be a bad idea and we're just waiting for the final results to come in? It's a tension. So how do we negotiate that tension? We have with us 4 people who experience this and live with this tension from different perspectives. Starting from my far left is Rubin Austria, who's the Director of Community Connections for Youth in the Bronx. I always find it difficult to call him Reverend Austria, but you do merit that title. He is an ordained minister. Next to me is Laura Wolf, who's a Senior Program Officer at the Robert Sterling Clark Foundation here in Manhattan, and whose background is largely in education and health.
So we fund policy advocacy across the spectrum. Yeah.
All right. Gabrielle Horowitz-Prisco, next to me, is the Director of the Juvenile Justice Project at the Correctional Association of New York, right?
Yep.
Of New York. And on my far right is Marlon Peterson, who is the Director of a number of things at the community, Associate Director of the Community Mediation Center in Crown Heights, Brooklyn. So let's open up this conversation and get into it. And I'll start with you, Reverend Austria. So you run a nonprofit. You run a nonprofit which works with a lot of young people in the Bronx. And you have a model which I've always found appealing. Perhaps you can describe that model briefly and then tell us how this conversation about evidence-based practice and policy is affecting your operations and your awareness.
All right, so Community Connections for Youth, which is an organization I started about 3 years ago, we set out really to do one thing, which is say how can we build the capacity of directly affected communities to keep their own young people out of the justice system. And currently have a program going, and we, so far to date, maybe have diverted about 70 kids from the court system in the South Bronx. And we doing this on a grant that I'd like to say was kind of a magic grant from the Division of Criminal Justice Services that actually said, we want a big idea that could change juvenile justice. We're not going to tell you what the idea is. You pitch it to us, and it just has to have independent evaluation. And it was like, that's magic, right? Because normally you're looking at funding sources, and the previous panel said that have the program out, it has to look like this and like this so that we know that it works. And so we kind of said, since there's probably not a snowball's chance in hell for us to get this grant, let's not say what we think the government people want to hear. Like, let's just put out what we would really do. And so very unscientifically, I said, well, if I drew kind of like a 5-block radius in each direction around my house, and I wanted to work with the kids in this 5-block radius and find the people who are already in the neighborhood, grassroots, youth organizations, churches, people who live in the neighborhood, and we organize the people in this kind of 10-block radius to work effectively with kids. And that's what we set out to do, and John Jay College became our evaluator. And what I'll say about there's some great stuff going on. We work with about 70 kids to date. keeping the kids all out on the front end, so they're all post-arrest, but we try to keep them out of the front door of court. So probation sends some, prosecutors send some, and as criminal justice policy changes, now we're actually going and picking up kids at the precinct, you know, to kind of divert the arrest altogether. And the stuff that we're doing is really, it's kind of the opposite of evidence-based in some ways, or in terms of like doctrinaire stuff, right? So we take in who's in the neighborhood, there's a community garden, and there's a guy who does, he teaches young people to like plant vegetables, and it's the exact opposite thing that you would expect, right? Like how is that evidence-based, but it's, the kids are connecting to it, right? There's kids who are doing art programs, and it's, the nice thing about working with the evaluation and our evaluators is that they're saying, okay, we're gonna have a logic model, we're gonna have a theory of change, we're gonna have a bunch of stuff, but what's gonna happen is that everything is gonna change, right? Like your assumptions are gonna be proven false, and then you're gonna have to change the logic model, and you're gonna have to keep looking at the data, and when the data proves your hypothesis, that's great, you'll celebrate it. When the data is taking you in a different direction, then we're gonna reevaluate the hypothesis and look at what's really working. And I don't wanna go on too long, but I'll say that, you know, we're hoping to become, and this will be years down the road probably, but the first program that is built really on the strengths, on a positive youth development framework, on the strengths of local communities, on the strengths of grassroots community organizations that gets an evidence-based designation. We don't have that yet because there's no randomized assignment, right? There's no control groups. It'll be a few years down the road, so you're able to look at the kids that we serve with a comparison group, and even then it'll be quasi-experimental to see how did they do. Right now we know that, you know, we're getting 83% of the kids to the program successfully. The thing that I love about what we're doing, and I think the best thing where we're kind of looking at some of the numbers, is that the average kids are mandated to our program for 60 days, and we said we think we can do something good enough with kids that they'll stay beyond the mandate. And everybody said that's not gonna happen. Kids who are not mandated don't go to programs. The average kid is staying 173 days. 56% of the kids are staying active in the program post-mandate. There's about 35% of the kids who've been with us since the very beginning who are still active now. And if you kind of look at the numbers a little bit crunchier, like 19 of the 70 so far who've been involved in multiple things, their average duration is 254 days. There's 10 kids whose families were real involved, their average duration is 333 days. And the whole kind of idea though is, can we create a community network that young people and families will connect to and stay involved with because it's just a good thing to be in. And so it's a very different lens from kind of the individualistic, criminological, what's gonna stop these young people from reoffending. And I think down the road, the evidence will show that they probably do have less offenses, but it's more about, as Professor Adams said, it's getting into the aspirational, the dreams, the hopes, and saying, what's gonna get people to a place where they're saying, man, I just wanna become the person I'm supposed to be, and I got some support around me that's helping me do that. And that looks very different from a very tightly defined model, but it's relationships, it's community, and it's starting with what's already in a neighborhood as opposed to we're gonna import something in.
So from that, I infer that New York's wide open for innovative ideas and people to implement program models that make sense to them, and you can get support for that. Is that accurate, Gabrielle?
I love being the advocate on the panel. You always get that kind of question. So thank you, Jeff, for having us here, and also for really keeping our focus, not just through this event, but in general, on really digging deeper into this question, which I think is really important. I don't know that I can speak completely to where New York is at as a whole. I can say that, echoing some of the concerns of the earlier panel, I do think that there is a tension between a push for evidence-based modalities and the kind of programs that Rubin is talking about. And I want to mention another concern I have that I think hasn't really had a lot of space yet, which is that a lot of the current evidence-based models are also clinical-based models with a very specific psychological or psychiatric framework, and that there's a risk, I think, of the over-pathologization and over-diagnosis and over-medicalization of children who may be engaged in just normative adolescent behavior, but are particularly from communities of color and low-income communities of color. So while I'm not wholesale critiquing the range of therapies like MST and FFT and many of the programs we're familiar with, I think there's a question we have to ask, which is, is it appropriate in all of these situations to have a social worker embedded in a family, or to have a child, getting clinical services for something that in another community is maybe just dealt with privately or in a non-clinical based model? And again, it's not black or white. It doesn't mean those programs shouldn't be funded or we shouldn't have them or that they don't work. But I think sometimes I get a little nervous when I hear people talking about, well, it's a great model. We have social workers in with the family. And it's like, well, what's the trigger for placing a social worker with a family, or for providing a child with really intensive mental health or substance abuse services? So when I went, I grew up in New York, and in my high school on Staten Island, public high school, not particularly great high school, right? But a lot of kids, including me, for example, smoked pot. And none of us got social workers in our homes because we were smoking pot, right? That was not a trigger for that kind of intervention by the government, which then opens up a person and a family to a lot of other kinds of interventions, right? So if you have a social worker in a home, or you have entire family receiving services, again, it may be appropriate. And I think Professor Adams spoke really eloquently about the host of issues that surround kids, and that on one hand we really do want to deal with, because children are living in context and living in family and living in community, and because children have such a lack of agency in many ways, right, we do have to address their needs contextually, and we have to address the adults around them. That's the way that children live, and that's what they embody. They embody context and family and community in a really deep way. But at the same time, I think there are risks when we start treating a child's whole system or family or community without discernment about whether that kind of intervention is actually appropriate and necessary, and without a really sharp lens on race and class in particular. And so how are, sometimes Tammy Steckler from the Legal Aid Society is asked, well, what does a youth justice system that works look like? And she says it looks like the one in Montclair, New Jersey, or in Maplewood, New Jersey, right? Where when white kids from upper class families get in trouble, there's a certain kind of intervention that happens, and that intervention often protects a child and a family from collateral consequences.
Thanks. So Marlon, you work in Crown Heights, the Mediation Center. Maybe you could talk a little bit about the SOS program that you're working in, and how do you experience these dialogue, this pressure for evidence in your program?
First, I want to also thank you for having me here. You didn't have a chair up here initially, so I had to bring my chair here myself. Interesting enough, before I answer that question, a young woman from, I think she's a Pinkerton fellow, rushed up to me during the you can't hear me?
Here.
Can you hear me now? Great. Interesting enough, before I came up on the panel during the intermission, a young woman from the Pinkerton, I think she's a fellow at the Pinkerton fellow, and she asked me, well, you seem like you're the only person here that actually works with people on a daily basis. So I want to know, how is it that you get in a position where you can sort of inform what's happening, yet still work with people on a daily basis? I want to credit you, Jeff, for sort of like, I also told that you got to start a little bit of trouble. So I appreciate you by kind of starting sort of trouble with in regards to evidence-based policy, where it's sort of the busting, it's sort of what is mandatory. It is what's mandatory now in terms of funding the programs. The Heights Community Mediation Center, which is a project for the Center for Court Innovation, we're an organization of innovation, we have several programs, and one of our most prominent programs is SOS, or Save Our Streets, and we take a public health approach to addressing gun violence. So we have people who we like to call credible messages. To speak to the point of the brother Quan, we have people who have been there and done that in terms of participating in gun violence out there, gangbanging, so on and so forth. So work is, so we like to say, it's like the vaccine. By taking a public health approach to addressing gun violence, these gentlemen and women serve as sort of like the weakened strain of this sort of disease we call violence itself, not the person. I'm not talking about the person, I'm talking about the behavior itself. And they serve sort of like a weakened strain of that same sort of illness to sort of, cure it. And as part of a larger model called Cure Violence, and myself is one of those persons, the Violence Interrupt, is the title that these people have, that work to reduce and stop gun violence industries in the offices where many of these people who may consider high risk of engaging in gun violence where they're at in their offices. And when I say their offices, I don't mean a place with 4 walls and light and a desk and a computer. I mean their private hallways, the corner store, the bodega, so on and so forth. That's their offices, and working with people where they're at to get them to the point where, one, they definitely want to they build a relationship with a person who they can trust. Then from there on, that trust relationship can then spawn on to saying, well, hey, listen, do you think you really want to do this? Is it worth it? I know you have a kid. I know you have a wife. You don't want to go back to jail. Putting those sort of things in their heads to make them think. From then on, it's a process of getting the resources they need and getting into resources they need, whether it be GED training, job training. Maybe they need a program, a drug rehabilitation program, so on and so forth, but just mentoring so that they can move from that antisocial behavior in terms of participating in the self-destructive behavior, which is using guns, to get onto the life of just normal people in the world.
Let me ask you, Marlon. How do you react when you hear people talking about the need for evidence and they say, what are you working on? And you mentioned cure violence. Oh, I know, that's the public health approach, but that's not an evidence-based program. No one really knows whether that works. Do you hear someone from the dominant culture intruding their values in your work, or do you hear someone who is trying to be helpful and knows about research and wants to close the gap? Like, is this primarily a threat, or do you see it as a cultural gap?
Well, I think it's interesting with the cure violence model, used to be called C5 Chicago. It received a lot of publicity and attention because of the documentary that came out a year or 2 ago called The Interrupter. So sort of the marketing of this program is what helped it take wind and replicate in different places and throughout the city and so on and so forth. And that's sort of, let's say, the plus that we had in sort of this program where you're working with people who, all the deleterious terms where they would call people informally incarcerated and so on and so forth. You're working with these people, you're paying these people to work with other people who are doing this sort of work. That's crazy. Why would you do that? How can you measure, you can't measure a conversation between this guy and another guy on the street corner where you're having a conversation, a dialogue with him, maybe his son or his girlfriend is right there, and you're kind of building a community right there. You can't measure that sort of conversation. There isn't someone there, and there isn't a control for that, well, we're doing this here and let's do it someplace else. It's just that's happening right now and it's working. And as I said, thankfully, because of that publicity, that movie and that model has now become the norm now. It's like more people are taking wind to that. But that's just that program. That's just SOS. That's just a secure violence model. There are many programs on the grassroots level within the boroughs here that I can speak about if I had enough time to list them all, that are doing very important, impactful work, but one, don't have the access to the evaluators want to evaluate their program, right? Sort of a relationship thing that one of the other panelists mentioned. You have to have a relationship with these persons, and if someone who doesn't have that access from these communities, they're not going to get that evaluator to come and look at their program. At least not one that is considered credible, right? So that's definitely a barrier in terms of that person getting credibility to the point where they are evidence-based. And I'm, be clear, by no means denigrate evidence-based policies and programs. We need to know that something's working so you can do it again. You can replicate it. That's the big thing that we do at the Center for Coordination. However, we need to be conscious of that the issues are driving, that the issue solving is driving the policy and the practitioners, not the practitioners and the policy driving the issue solving. We have to be conscious of that sort of thing. Sometimes we get lost in this model of we can't do this program or we can't give this program any sort of credence because it's not evidence-based. Even though you may be doing good work, we can't really give it the sort of credibility that it needs. So we discredit it, or we just pay no attention to it, and it takes money to try to make these programs work, and if you don't have the money to do them.
Let me ask just a quick show of hands. How many people have seen the film Marlon mentioned, The Interrupters? All right. And so it's a high-quality, feature film quality documentary where they followed around the outreach workers in the neighborhoods and watched them intervene and try to stop the escalation of violence after a shooting. And as I think about that, if you told me that I could choose one of two things, either a high-quality evaluation published in a prestigious academic journal or a movie, I might pick the movie to protect my own program. And it just raises the issue of, this is a communications challenge. I mean, I don't think anyone's going to survive if the only things that are produced about their program are published in academic journals. That's why a lot of us work on alternative, we do PDF reports that go up on the web, we do short pieces, policy briefs. You do need to pay attention to the high quality research, but if you only did that, I think your program would be in danger. And I think that's why a lot of people just grasp onto previously anointed programs, because they don't have the time and the energy to develop all this evidence. So it's a communications challenge that has to come together. And I want to turn to Laura Wolf from the Robert Sterling Clark Foundation. How does all this come together? And do you see a mechanism for sort of growing programs and then solidifying programs? How does that work?
Well, the last comment was a perfect segue. What the Robert Sterling Clark Foundation funds by and large is public education and advocacy aimed at informing government policy. And one of, not the only, but one of the sources of data or information is program evaluation or other argument about why government should spend its money in one way rather than another way. So I thought it might be useful to just look at the trajectory of how in our society money gets to programs and other endeavors. We live in a capitalist society. Anybody who wants to do something, either they use their own resources or they have to get somebody else's resources. And they have to convince that other entity to invest that pot of resources in their project. They can do it by appealing to a belief in themselves as the individual, in their own rationale for why what they're doing is useful. This applies whether you're going to a social venture, to a corporate venture capitalist to say, I have a new widget that's going to, make it easier to tweet on different kinds of phones. You should invest in this because it'll be the next app and you'll make millions. Or if you believe that you have a great way of preventing kids from going to jail, somebody has to be able to articulate the rationale. And it sounds, when I first read the description of the symposium, I thought you were talking generally about evidence-based versus no evidence. You've made clear in many comments that you're not talking about that. You're saying we don't want to be limited only to random control, generally individual clinical research, but we want to be able to look at whether interventions that are not as easily tested using that model are effective, and you use the term promising practice. So I think the point is just that anybody has to be able to articulate why their practice is promising. And you can do that based on your sense of the kids in the neighborhood and why they will come to your program. That does help, that you've now tested, that they actually stay for 6 months, and you can tell a funder that. But I would argue that there's different kinds of funding, just like there's social venture capital money. There's philanthropic dollars that may take a different kind of evidence, and the rationale that you give based on your knowledge of the kids in your neighborhood and the first 6 months of your intervention. But do we want large amounts of public sector money to go just on a small body of evidence, or do we want to say, okay, come back when you have 1,000 kids in your program? And saying, we've made the health analogy, no, criminal justice isn't the same as health, but I don't think people would want to go to the hospital and say, today we're going to try out a whole different approach to preventing infection. And they say, no, we like the antibiotic method, it's been shown to work, I want my kid to get the antibiotic. But you could say, well, those of you who are looking for, a vaccine against HIV, some of you people who are at high risk for HIV can come into our study and you may or may not get a treatment that will work. I think we have different approaches for testing what's effective, but that doesn't mean that evidence-based is a bad word. I think it sounds like what we're really talking about is broadening the definition of evidence and teaching more people, like what John Jay is doing through placing evaluation-oriented people in community programs, teaching programs to say, this is our theory of change, this is our logic, we have revised our program model based on our early findings, and this is why we think this is really great. and you, new foundation, should invest in it, and you, government, should then take it on.
This raises a very interesting issue for me, or something I think about a lot, which is, you mentioned philanthropic funders, you mentioned government funders. How do we, I'll try to put this sensitively, but how do we deal with the fact that the sources of capital you need to invest in a program to do enough research they don't come without strings? The people who make decisions about where the money goes are either, if it's an early generation foundation, the people who actually develop the funds through their business, or they may still be around, or they may be on the board of trustees. They have a certain class basis from which they see social problems. And the same thing is true in government. It may be a little attenuated in government, but just think about all the individual entrepreneurs who serve in government, who are on the key committees, who make the decisions about where the funding goes, who decide, I mean, it used to, in the old days with the earmarks, the federal Congress used to just direct funds to programs and pick and choose. So how do we deal with the fact that people who are making the decisions about where the resources go to support certain program models are not free of bias and their own interest and their own perspectives about social problems and how to fix them?
I would say that is the role of advocacy and public mobilization and informing journalists and the field at large and making your case. And that we live in somewhat of a democracy, and that is the only strategy we have for informing those in politics, in government, is raising the voice and making the case. I mean, it doesn't always work, but I don't see, it's not going to happen only by publishing research in peer-reviewed journals. It means getting the word out and becoming articulate spokespeople in your communities and beyond it.
And yesterday's a good example how it doesn't always work.
Absolutely.
86% support.
Bob Marley has this part, and he says he's sick and tired of ism schisms. I think definitely there are a lot of ism schisms that prevent people who are directly affected by these issues to have a value placed at the table when it comes to determining how we define evidence in terms of evidence-based policies. And you made a key point, or in terms of we need to broaden that definition of what evidence-based policies are, because as mentioned before, we need to know what's worked to do it again and do it again and do it again. But also in doing that, we need to know there's differences in terms of what works in one community and what works in another community. There's very different dynamics in Bed-Stuy than it is from Fort Greene, Brooklyn. It's very different dynamics. So we have to be conscious in terms of how we implement or how we value these sort of these evidences in terms of where it's replicated at, what we want it to be replicated at. So that's another point I want to bring out there as well. But I also feel that, as John Jay is doing already in terms of Mr. Travis mentioned that, the Princeton Venture Institute and, having people who are, directly affected by these issues, part of academia, and definitely inform these issues. That's definitely a start in the right direction. Another thing also when it comes to young people, and you mentioned, someone mentioned about participatory engagement. I see my colleague over there, another colleague of mine. We need to be able to engage young people at a valued standpoint, not just sort of just dog and point show. Well, we have a couple of young people here together. They're going to come together. They're going to do some research, and then we're going to put out there and say, "Hey, look what the young people did." No, you have to train them. One, that's the first thing, but we also have to value their voice in terms of, and then advocate for them in places and tables where they can't be at. They can't be here right now. They're in school, so we need to be true to the core of those people, those young people that we are training. So, in the Center for Innovation is a youth justice board, and the young people there inform policy in terms of they've done research on police-youth relations within the community. And their work has been published, and it's not just something that we put in a nice little book and send it out to school. It's published in academic research. And that's one way in terms of being able to, one, get the voice of the people who are directly affected by these issues, and then bringing their voice to the table, very genuinely bringing their voices to the table.
Can I jump in?
Yeah.
I want to say part of the, how those decisions are made, it also comes from how you define the problem. And a lot of the lens, I think, of evidence-based says, well, you got like broken people that you gotta fix so they can work in a functional system. And that's the lens that a lot of research comes out of. And then I think when you get deep into this, you realize the system is often more broken than the people that it's trying to fix. And so you gotta stop saying, how do I get people to behave functionally in a dysfunctional system? No, you gotta broaden a little bit. And so the way that we tend to look at it, right, is also to say there's been a real loss at the community level. Like we've lost a bunch of stuff with this reliance on incarceration, right? We've lost our young people, but we've also lost the dollars that are associated with them. And you look at those studies of like $1 million blocks, money leaving the community. And we also lose the experience and the wisdom of what it takes to kind of hold young people accountable, to work well with them. And a lot of that experience is lost in the same people who are taken out of the community, right? And so now we're in this trend of we're moving back away from it. We're saying, okay, yeah, incarceration doesn't work. Let's invest in stuff that does work. And you're getting the kids back in the community. Is the money really coming back to the community, or is it coming more to intermediaries? And are the people, is the experience coming back in the form of community people? Or again, is it coming back in the form of professionals? And so asking the question of, this question of who wins, who loses, when I saw the shift in New York towards evidence-based, a lot of it was, let's bring the kids back, but we're still afraid to engage with the communities where young people are coming from, and the resources that we've taken out of those communities, we'll put them back in sort of, right? We'll put them back in the form of programs and professionals, but are we gonna actually invest in the folks on the ground who often have different ways of understanding the problem that are often more profound? And I say that again to say, where I found that sometimes the evidence-based folks are more doctrinaire, faith-based than faith-based folks, right? And I say that as a minister, where it's like they're kind of going, well, that's not in the Bible, we don't believe that, right? Or that's not in the panoply of evidence-based programs, we don't recognize it. But people are saying, wait a minute, we have other ways of talking and communicating change. Right? And some people will say, and this is the mentors I used to interview, all these people were saying, well, I went to a service and the Holy Spirit came into my heart and I was instantly delivered from drugs. And when 15 out of 20 people say that, you go, maybe there's something going on here. Right? Or people who say, I was in prison and I got involved with the Muslim Brotherhood, and but all these things where you're saying people are experiencing life change in ways that don't fit the doctrine of evidence-based, but it's happening. But my thing is really, if we're talking about reinvesting the resources where they need to go to, it has to be expanding the definition to say, people have ways, and especially in communities of color, of experiencing change that, again, don't fit into that narrative of this was the individual change pattern, and yet it's the same truths, they're being communicated different. But those people have to be at the table when a policy are making, because who I saw lose, again, when New York started to change, it was saying, well, we're no longer gonna just lock people up, but because we're still afraid of these kids in these communities, we have to have something that we feel comfortable enough saying, if the poop hits the fan, well, at least we had some studies. And to say, no, let's get to the principles underneath the studies, because those tend to be true. And if I could use a fancy word from your world, right, when you do meta-analysis and all that stuff, right, like, I like to say that and all that stuff, right, like, but the meta-analysis kind of says, well, when you look across the different studies, there are some core principles. And the core principles are the same thing that people in the faith community would say, the same people, honestly, right, if you looked at radical movements and Black Panthers and Young Lords, and say, it's those change processes underneath are the same, and that just different language.
Last comment.
Yeah, so two things. One, just building on something Rubin said, I think something that would be helpful is if we all hold space for the possibility, I think this was alluded to in the earlier panel, that the things we take to be gospel now will shift and evolve and change. And that 20 years from now or 40 years from now, there may be a conference where people are like, oh, those things they did in 2013, look at how far we've come, right? And just like we look back on things that once seemed true a long time ago, and we think, how did they do it that way? And so to just hold that critical space and willingness that there may be more than we can see with our limited field of vision, and that it's not so simple. It's not about these programs being good or bad, but that knowledge is a process, and evolution is a process, and that community and culture is a process. and also that our evaluation is culturally embedded and contextual. So like I also think like I do a lot of medical care in an Eastern model, and acupuncture, and I work with a naturopath, and that model of like looking at well-being is very different from a Western medical model, and you know, both have advantages and disadvantages, but there's almost like a cross-cultural conversation that needs to happen, and I think Rubin made that point really well, that there's ways of knowing that we currently don't have a space to capture. And the last thing I want to say is, I guess, a little bit of a challenge, and some of this is happening, and I applaud it happening in New York, but I think we could have a deeper conversation about holding detention and incarceration practices to evidence-based standards. So the field of criminology is, you guys clap, that's awesome. Like the field of criminology is very clear, right, that detention and incarceration hurts children and actually leads to worse public safety outcomes. That evidence has been around for a very long time. For example, also looking at prosecuting children as adults. So the CDC did a meta-study. They looked at 7 different studies. They found a median increase of 34% violence when we prosecute children as adults, when we transfer them to adult court. Yet we do it here in New York State. Why are we not holding policies of detention and incarceration and New York's age of criminal responsibility to the same standards that we hold a community-based program that does youth development work? So I think we really need to say, thank you, we really need to say that that same pressure to conform youth justice policy to evidence needs to apply to the practices of detention and incarceration and of prosecuting children as adults that New York State is still engaged in, where we spend, $250,000 a year or more to put a kid in detention, $266,000 a year to put a kid in an OCFS placement, where we're spending a lot of money prosecuting children as adults despite the fact that it increases violence and recidivism and felony property crimes and future violence, and we don't say where is the evidence-based response to those practices.
Sitting right next to Gabrielle, I could feel her shift into third gear. Okay, we have a little bit of time for questions. And before we move on to questions, I forgot to do my job, which was to point out the hashtag on the screen there if people are on Twitter. So whoever's got the microphone, we have questions over back there. Someone needs a microphone. And say your name and any affiliation you care to share.
Hi, my name is Claire Strange. I get nervous in front of crowds, so I to regret it, just ignore that. I work at Exodus Transitional Community, right up in Harlem. And Jeffrey, you mentioned something earlier that sparked a question in me, in that if you had the choice between watching this documentary, The Interrupters, and reading an academic journal, that you would choose documentary. And I think what you meant by that was something a little deeper, in that qualitative versus quantitative, the evidence, what are we talking about? In that the movie would be representing more the qualitative side of the evidence, and the journals and evidence-based practice, when we say that, we're more or less talking about quantitative stats, numbers, things that can quickly become outdated as well as dangerous if misinterpreted or put in the wrong hands. So for those of us who have studied the social sciences and are very familiar with qualitative evidence, it becomes apparent that we need to broaden our definition of evidence, especially working with at-risk youth and ex-offenders, where success rates, numerically speaking, are not always pretty.
Can we just deal with that then? Because actually you were being deeper than I was. What I meant was not I prefer to watch a movie or than read an article. I meant in order, if I were running a program and trying to protect it, and I could either have an article out there or I could have a feature film describe my program, I'd go with the film.
Right,
So,
okay.
But I appreciate the comment. I want to include some more questions too.
Sure, well, I do have a question. Is
All right.
that, how do we find that balance between these two types of evidence, and how do we capture the importance of both and communicate that to others?
Right, exactly. But I think that's what we're here talking about today, that there has to be some balance. And please make these questions. We don't have time for a lot of long statements, but whoever has the microphone is in charge.
I'm from the Bronx Juvenile Justice Initiative, where we do alternative placement advocacy for youth.
A little closer.
We do advocacy for youth to help them get alternative placement programs instead of incarceration. My question is in regards to the environment. In particular, I noticed that young people, when they are arrested, they're taken to a process, and I know Gabrielle spoke about treating them as though they're adults. In Bronx Family Court, it looks just like a regular criminal court, and I have youth who, we've gotten them out of being placed, but after they have to go through that process, it seems like they already feel like they're being treated as though they're criminals. And I don't know if part of what the community organizations are doing or our alternative placement programs are doing is just getting them out of the environment of being in a situation where they are treated as though they are criminals. So can that be included in the evidence as far as if we're saying that these youth, because they're juveniles, are different than adults, why are they being processed in the same way that a criminal case would be processed for an adult?
Reverend, you want to take that?
So you're saying like just shut down the family court altogether, right? Well, yeah, I mean, I think again, as to Gabrielle's logic, there's a whole, like when you criminalize people from the start, that sets a whole trend in motion. And if you don't do that from the start, that's a good thing. And I'm sure, again, you can look at evidence in all, like there's the science of design and how people relate to their environment, and even things that people will tell you about, how nasty was your attitude based on how nasty was the attitude of the court officer who told you to take off your belt, right? Like it's all of those things play a role, but I would definitely agree that, and this is what our approach is trying to do, is to say if I think what the evidence does show, right, is that there's a lot of kids that if the justice system never touched them, or if you didn't do anything at all, they'd be better off, right? And so how can we not rely on the justice system having to be the trigger point for getting kids involved in stuff that's going to help change their lives? And the earlier you can do that, the better. And the earlier that you can do that involves just spreading the involvement of so many more people who are not necessarily even involved in formalized programs, right? And the pastors and the bodega owners and people who will understand that maybe I can pull this kid into something before they formally touch the justice system, because it is the outcomes tend to get worse and worse the deeper you go.
You have a really quick comment, Marlon? You have the mic?
I don't have the mic.
All right.
I just want to second what Rubin just said in terms of getting them before they actually get criminal justice system, and that's speaking to youth development programs. Where just yesterday I had a friend of mine ask me for any sort of programs for a teenager who has no criminal justice involvement, and he said, well, it's hard to find anything because he hasn't had any criminal justice involvement. So we got to wait till he gets criminal justice involvement to do something about it, right? That works. I guess, so I mean, just to speak to that second point though, that in terms of youth development programs, that they're difficult to measure in terms of how they're actually effective, but we can see the importance of them in the place of sort of making the work that we do in criminal justice less relevant.
All right. Thanks very much. When we put together these panels, I knew it would be easy with the people we have here today. Facilitators have an easy job, and I think this was fantastic. And please join me in thanking them. We are trying to stay on schedule, and so I'll turn it over to Ann, and you'll do the mechanics.
Yes, I'm going to do the mechanics. Well, you know where the restrooms are, so let me just give you an update on how the rest of the day is going to go. We've got about 10 minutes between this panel and the third panel. There's coffee.